But we are going to be joined right now by an expert in the mental health facilities here. We're talking about the coronavirus outbreak, and I believe we're going to pull her up now. Caitlin McClear is joining me right now. Dr. Caitlin McClear from Synergy Psych. Thanks for being with us. I believe we have you.
Yep, I think I'm here.
All right. Yes. So over the past couple of months, the importance of mental health, I mean, it's really been impacted. Folks have been dealing with things they've never had to deal with before. Can you walk us through why it's important for people to reach out and get help if they feel like they need it?
Well, I think we want people to not feel like they're alone in this. We know one of the best predictors of mental health and staying mentally healthy is social support and having a group of people to talk to. So, if you are struggling or someone you know is struggling, we want you to reach out, whether it's to loved ones or to encourage them to seek mental health or services.
And we talk so much about washing your hands, wearing a mask, those things, but I don't think we've talked enough about people that are just not reaching out to get help. And I think one of the biggest issues coming out of this will be people's mental health, because I think people have not been able to socialize as much. You have the elderly who have been left in nursing homes with only their, people taking care of them. They're inside, the nurses, they don't talk to family. Kids, they don't really know much about what's going on. It's kind of hard to tell them you can't go outside and play on a playground for 2 or 3 months, and then trying to explain to them how to get back into school, but you're gonna have to social distance. I mean, I don't think a lot of people understand the effects we'll see on this in the months to come.
Yeah, definitely. There's definitely going to be a new normal. And I think for people dealing with that, I really encourage them to try to find a new routine. So incorporate your old daily routines and try to find something new that kind of changes with our new normal. Focus really on what's going on right now. So what can you do every day to improve the day? Still try to reach out to people, engage in self-care as well. Make sure you're eating, sleeping, exercising, all of those things. And for kids, it's trying to stick to what they know and to answer their questions appropriately and, kind of talk about things are different now, but here are some things we can look forward to still.
And what about folks who, had issues before COVID-19 and maybe did not reach out to help during this time, and maybe, things are not getting better? What do you tell folks, who going into this, we're already having some problems adjusting to just the reality of things, and then this kind of, compounding on top of that? I'm sure it's gonna be rough in the next few months for them to get back to a normal and maybe reach out for help.
Yeah, definitely. I mean, we have definitely seen kind of in people who already have had some mental health concerns, kind of a increase in those concerns. So I'm really encouraging them to, decide to reach out to a mental health professional, their family, their friends, their physician, and kind of encourage them to, it's never too late to learn some skills and some ways of coping with anxiety, depression, and all of those sorts of things.
And what about sleep patterns? I know that can really impact you as well. We've talked a lot about sleep here, and what do you guys see with that, as well as how that affects your mental health?
Well, sleep's huge in mental health. If we're not getting adequate sleep, we have less patience, worse mood. It can, impact your physical health as well. I've seen a lot of people who have had sleep disturbances just because our patterns have been thrown so off. So kids who are sleeping in all day, staying up all night, people who aren't working regular hours. So I'm really encouraging people to try to stick to a normal sleep routine and just practice really good sleep hygiene. So kind of winding down, making sure they're not doing anything too active or engaging right before bed, and just making sure they're still getting that restful sleep.
And what do you want to tell people out there who might be struggling? What are some of the outlets they can use? I know there's still some restrictions, social distancing, but how can people reach out and get help?
I think we always tell people to start with a primary care physician. They have a lot of resources of who is accepting new patients. There's a lot of providers in the area and just nationally doing telehealth. So that's definitely an option. I know the state also has some resources for just different mental health services from, private providers to more community facilities as well. So I would definitely start there.
Okay. Is there anything else you want to add to folks that are watching that, I know it's been a rough couple of months and we still have a few months ahead of us before I think things start to, I don't know if there's a new norm, but, we just heard the governor mentioning some restrictions being lifted, but I think we have a long ways to go with this.
I think the biggest thing is just kind of have patience, try to stay in the present, really focus on what's going on now and don't get too lost in the future. Because I think that can be pretty overwhelming when you think about what's still restricted and what might come. So we just like to try to focus on the present moment.
All right. Well, thanks so much, Dr. Caitlin McClear, for joining me. A little rough at the beginning. Still getting used to this whole Zoom interview live. So thank you so much.